Welcome to the Auburn Medical Group YouTube live stream, the entertaining medical live stream where viewers can ask real-time questions of real medical doctors. And here are our hosts, Dr. Mark Vaughn and Dr. Gwen Vaughn. Welcome to the show. It's Dr. Mark Vaughn and Dr. Gwen Vaughn and a special guest. We have Dr. Nassiri. Dr. Nassiri, I'm going to put the camera on you so you can say hi to all the people watching us on the interwebs.
Hey.
Hello, everyone. She is real. She's actually in the studio with us, just not in the... She's like right there. Really close. So we have Dr. Nassiri. The first time we've ever... Does that keep falling? Yeah. The first time we've ever had any other doctor ever.
That's right.
Practicing medicine with us at the Auburn Medical Group. It's exciting.
We had what's her name once? She was
another
Walker. Vanessa Walker was here in between us once.
Oh, no, I meant actually practicing in the office with our patients.
Oh, actually, yeah.
Yeah, she was a guest on the show.
Yes. I thought you meant guest.
I was just telling her about Dr. Walker being on the show.
Yeah.
Because she, of course, knows Dr. Walker.
Oh, I'm sure you do.
She's at Sutter Roseville Hospital.
Amazing.
She's the CME, is that her?
Yeah, Chief Medical Executive at Sutter Roseville Medical Center. Yeah, she's been climbing that ladder since we had her as a pulmonologist visiting on our show. Dr. Nassiri, let me put you on. Dr. Nassiri is a resident physician in her third year of the internal medicine program at Sutter Roseville.
Man, you can...
Second year. I thought you were a third year. Okay.
Almost.
So you're
almost
like almost halfway done.
Yeah.
So Dr. Nassiri, in your second year, halfway through your program now.
Yes.
And in internal medicine at Sutter Roseville Medical Center, and doing a great job already in our office. We appreciate what you've been doing here.
Thank you so much.
And we wanted to have you here because you are right in the midst of residency, and you can tell our viewers what it's like. But wait, first, let's take our comments. So we have, who do we have? We have,
who's with us?
Who is it?
It's not coming up.
Laura Webb.
Technology.
Hello from Tennessee. Hello, Laura. Thanks for joining us today. All right, getting back to Dr. Nassiri. So, Dr. Nassiri, you're in the middle of your 3-year internal medicine program.
Yes.
And from there, there's a lot of options for what you can do once you finish general internal medicine. What are some of those options that you could choose to do?
A little bit of everything, really.
Yeah.
Yeah. So,
options abound.
Yeah. I mean, from the residency side, from internal medicine, it's really just kind of open air, right? Cardiology, nephrology, endocrinology, any ology that you can add absolutely is at your fingertips,
Even
right?
gastroenterology.
Absolutely.
Some of them are more procedural than others. Gastroenterology,
Correct.
Obviously, very procedural.
Oh, yes.
But even pulmonary, they do a lot of procedures.
Oh, absolutely.
I mean, the entire ICU. So people may not understand that ICUs are run by people who first did internal medicine residency, where you are right now.
Yeah.
And then went on and did either critical care or pulmonary fellowships.
Absolutely.
Yeah.
We get our training from a lot of that. So I've had the pleasure of doing many procedures myself.
That's awesome.
Yeah, already you would have been in the ICU. And,
oh, yeah.
Yeah, covered really critical stuff.
Yeah. It's been exciting.
Do you rotate through the emergency department?
I have not yet. That's more for our third year. But definitely something to look forward to.
Good.
Yeah.
All right. Good. And then Dr. Gwen, you remember back to those days when you were doing medicine in your family medicine
That's right. Yeah, family medicine. I was just overhearing some of what your residency is like. Okay. And it seems much, it's kind of interesting because it's different than mine. As a family practice doctor going into my residency, most of us know that we're going to be doing outpatient medicine. So we do a lot of clinic, we have our own patients, which we were seeing weekly, sometimes multiple times a week. And it sounds like you don't have your outpatient clinic but every 5 weeks or something.
We do have clinic exposure, but a lot of our training is very hospital-based. So we get a little bit of everything, to be honest, with the different subspecialties too, that you can rotate in.
Sure.
But yeah, primarily I would say it's more in the hospital.
Right. So they're kind of setting you up to be hospitalists. And that's mostly what internal medicine doctors are. They're working in the hospital or we're moving on to one of those specialties. Yeah. So that's kind of interesting.
Definitely outpatient is something that a lot of the residents are considering as well. I think it's a huge interest.
which we need. I mean, all over primary care, which for adults is internal medicine. Absolutely. And with our aging population, many people over 65 and entering into Medicare, we need internists for sure.
We're going to take a little break here to look at our chat. So we have Bernadette Kearney saying, "Good evening from Cyprus."
Hello.
From Cyprus.
Oh my
wow.
goodness.
Other
and then
side
back
of
to
the-
Laura Webb. Has she decided what she wants as her specialty?
Good question.
Great question. I've dabbled and quite a little bit. There are a few specialties that I have my interest in, but I'm not going to say any one particular for sure.
Okay.
I am halfway in my residency, so I do have a little bit of time. Definitely considering outpatient. My personal favorite I always loved in medical school was endocrinology too.
Endocrine.
Oh, nice.
So we'll see.
Yeah. So I guess your bread and butter in endocrine would be like diabetes, but also helping people with their abnormal thyroid.
Hormonal.
Yeah. But I would imagine with our population, diabetes would be quite prevalent.
Very prevalent. Yeah.
She's already spent a day in our office. Yeah. Okay. Yeah.
Yeah. We see all the other endocrine issues as well.
Yeah.
Yeah, just not as much. A lot of diabetes.
Prevails for sure.
Yeah. So, and you can certainly, even until a year from now, still be looking at different specialties or general internal medicine, either inpatient or outpatient.
Absolutely.
Either one
you could do. Yeah.
Yep.
Now, part of family practice, we do a fair amount of outpatient procedures. Tell me about your exposure to that or what you want to be exposed to.
Yeah. So, I mean, I enjoy doing procedures. I think it's really awesome to kind of get your hands in, feel like you're doing a little bit of medicine, right? Yeah. I personally am still kind of in the training process, so I'm getting exposure to the different procedures. Sometimes it's a little bit limited from what we have from the residency side, but we're definitely getting a lot of different in-office procedures.
Good.
I've done quite a handful of pap smears are something that we do in our office. We do steroid injections quite a bit. Just a few that I can remember off the top of my head. But we're getting
putting in your central lines, but that's not outpatient.
That's more ICU, which we've done as well too, but definitely not outpatient.
I cannot remember the last time I did a central line. It would have been in residency.
I don't see either of us doing any more.
It would have been in
lines.
residency.
Yeah.
We do have a comment from Bernadette Kearney. You are mentioning everything I have. I guess was that when we were talking about
you're
endocrinology?
Be a specialist for her. With everything
or all of those other specialties.
Yeah.
And Laura Webb also is saying, your reception is not good today. It may be due to the storms in Oklahoma. Oh, Laura, I'm sorry you're having storms. We're not aware of any transmission problems with the signal going out, but certainly if other people mention that, then we'll
let us know.
We will look into it. But as far as the other feedback we're getting, we seem to be doing okay. But thank you.
Did you tell us a little bit about your past? Like how did you get into medicine? How did you get interested in it? And I'm just curious a little bit about that.
Yeah. So, I mean, I guess everyone has a different experience, different, kind of beginning. High school is when I really enjoyed the field of medicine, pre-health, kind of where the passion started. I was pre-med for my undergrad. Took a little break, worked more, and then just kind of was like, hey, you know what? I left this and I need to finish it because that's kind of where my calling was. And so I came back, went to med school, and I haven't regretted it since.
Oh, that's great. Yeah. It is definitely a calling.
Yes.
Yeah. You get that. To do what, especially where you're at.
It's a huge sacrifice, right? It's such a huge time commitment. It's family, time away from family, time away from life, time away from social things. And so, you really have to know what you're committing to before you do that. So,
And then financially, you're carrying all that debt from medical school.
Oh, gosh.
Well, not making a salary that allows you to really do anything on it. It's just building up the interest while you're getting through residency.
Oh, absolutely. Yeah. So it took some time to kind of be like, is this really something? And I was like, no, this is... I should have listened to it from the beginning and not do that. But, to each their own, and everyone has their own journey. And I'm glad.
Excellent.
We spoke a little bit at CMA, House of Delegates, a couple weeks ago about not necessarily the large general house conversation, but in some of the smaller groups talked about educational debt, because that's universal, and how crazy some of the debt is that doctors are having when they get out of residency.
Absolutely.
And it's for many parts of the country, it's the purchase of a home. So in addition to your living expense, you also have this other
More
mortgage
than some parts.
for your medical education.
Yeah.
So we are aware of that. Dr. Gwen and I, myself, we both finally, actually, I think, did you beat me paying off your school debt, even though yours was twice as much as mine?
I don't know. I don't remember. But yeah, we both paid it off. So.
Yeah, but
So there is light at the end of the tunnel.
There is. You can do it. It's there.
Good.
Between you and Dr. Gwen's advice, and who's that guy on Dave Ramsey?
Dave Ramsey.
You know what? My mom
white
swears
coat.
by him.
Oh, he's great.
Yeah.
The White Coat Investor.
Yeah.
He's
Oh,
good
yes,
too.
I did purchase that book.
That's a good one.
Well,
Yeah.
I tell you, Dave
I'll
Ramsey's
talk more about
advice
that.
will never get you a medical practice. I'll just say that.
That's true. Yeah, because he says no debt, and there's no way to get
there's
into it.
there's no doing medical
I
school.
guess we already. Yeah, I would listen to one of his.
Maybe he makes exceptions for it.
Yeah, I don't know. I don't think he does.
For
Because
medical school.
I heard him say, like, somebody was called in and wanted to be a doctor, was like laying it all out, and he's like, "No, you shouldn't do it."
Oh.
The guy's like,
Then nobody would
"This
become
is
a doctor.
what I want to do."
Right.
Yeah. I mean, but then, anyways.
Yeah, let's look at our comments and questions, because we have. Oh, that's the one that was already up there. Bernadette says it happens when you turn 70. Lol.
Oh, she's the
Lots
one
of
with,
love.
with the. She's the one that needs
She's
a
the one
different
that
doctor.
needs a doctor for everything. And
You just need a good internist that can take care of it
I
all.
will say that there's, this preconception that certain age, comes with all the diseases, right?
Yeah.
But interestingly enough, you work in the hospital long enough, you're just like, age has nothing to
You
do with
see
it.
it
You will
all.
see
Yeah.
everything in every
Well,
age group.
more as you get older, because you have more
Yeah,
years for it to
absolutely.
happen.
Start to,
But
Yeah.
And you accumulate things.
Yeah.
we also have Michael
Diagnoses.
Zoros. I think we've had him before. You need to ask yourselves the same. You two need
What
to
questions
ask
do we ask?
What?
Ask ourselves the same question.
What do you
Why did we get into medicine? We've asked
Like
ourselves that.
it's good to review that. I guess that's what it's referring to. Laura says, is there any new treatment for thyroid disease? Would you want to take that one, Dr. Nassiri, or would you rather
Yes,
pass?
Miss Endocrinology.
Oh, goodness.
New treatments.
I don't think I have an answer to that, to be quite frank. And I think thyroid disease itself, it's such a huge range of what
Yeah,
disease are we talking
that's true.
about. And, so it's not a blanket answer, to be honest.
Yeah, you kind of
So-
you need to know more. You're good at this. You should be back
way
on
to
the show.
hedge. No, but it's true. It's
Yeah.
absolutely true what
Yeah.
you're saying.
What
The thyroid can have many things go wrong with it. There's no, even saying that up front, the entire broad world of thyroid disease, I do not know of something new going on right now.
No.
Although I would like to throw out that little thing of,
We still
for
treat
those of you who are using Armor Thyroid or some kind of animal source thyroid, because it seems to address your symptoms better, it's probably because you're not getting the right balance of T3 to T4 that you're going to get through an endocrinologist more likely than your primary care doctor.
Yeah.
Because it's kind of a step beyond what we usually have in the primary care realm. And you're not getting the best if you're getting the Armor Thyroid compared to if you get the right balance of the T3, T4. That's my understanding of that. That it's so easy just to give them Armor Thyroid, and you'll satisfy the symptoms and get them maybe in range, but it's not really the balance they need for a human. Okay, back to the questions and comments we have. Oh yeah, Laura Whit, and then Darla Whitmer. Hi, all from California. And
Hey,
we're from
that's where we
California too, Darla. And
We're in
Darla also
California.
saying,
What do
I
you know?
missed what Dr. Nassiri said her special is. Well,
Probably specialty.
we
is
will
what
go
you're
back to
asking
Dr. Nassiri so she can restate her specialty.
Sure. So currently I'm an internal medicine resident. I don't have a specialty as of yet. Still working on that. Have some time in my residency program to kind of figure out the direction that I want to take. So internal medicine for now.
Yep.
So I would say, coming out of medical school, the two major paths you can take are medicine or surgery. She chose medicine, not surgery. of course, there's other things you could divert off to, pediatrics or emergency medicine or psychiatry, even that early on. Yeah. But in general, the two big things are medicine or surgery. And even pediatrics, I would say, is kind of like medicine, just medicine for people under the age of 18. Good.
Yeah.
All right. So, one more comment. Here we go. Back to comments. Bernadette Kearney, thyroxine and have been 20 years. I'm on thyroxine and have been. I like the way she uses the picture of the cat. I love the... Thank you, Bernadette.
Yep. Thyroxine is still the mainstay of treatment for those who have low thyroid.
Correct.
So, you'd be doing a lot of that if you went into endocrine. In your program, it's a relatively new program. You will be the second graduating class from it.
The first one's
How many members per class?
In my class, we have about 14.
Wow, they didn't start out small, did they?
No.
Wow, 14.
Decent.
Yeah.
Man.
My whole class, we had 7.
Yeah.
Oh, wow.
Mine was 8. Yeah,
I think 13, 14 is about the class sizes.
But medicine is big because there's lots of people going to general internal medicine because, like we said before, all those specialties that come from, or subspecialties of medicine, they all come through general internal medicine to get there. So that is, if you're starting a residency program, medicine and surgery, and they started out with medicine and surgery at Sutter Roseville?
Correct.
Okay.
That's right. They got surgery too.
And then what new programs have they added?
This year, they actually added transitional years.
Okay.
So we've had a new group.
You're going to have to explain that because most people won't know what a transitional year is.
Yeah. Transitional years, usually residents who are going to go into different specialties like dermatology or radiology or, things like that.
And they just need a year of base medicine just to kind of understand it.
From my understanding, it's either medicine or surgery.
Yep.
So if you're choosing medicine, then you kind of rotate with internal medicine residents and you kind of get the same training that first year before going on to your specific field. They do have a couple more programs that will be coming, but I will leave that to be discussed at a later time. I don't want to ruin the surprise.
Oh, I'm not supposed to say?
No.
Well, we know.
No.
We know them. So.
Yeah.
If we know, I think anybody would know, right?
I don't know. Those are at some of their executive type meetings, but I don't know.
Oh, okay.
I don't know.
All right.
But anyways, if they told you not to tell anyone, we won't tell anyone.
I didn't know it was
I didn't know that either.
No, it's not. But
they have to go through a lot of credentialing, so which they're in the process of.
Right.
Yeah.
Maybe a good question that people, let's say a patient were to come into our office and they're on your schedule and they see you. How is that different from seeing a quote unquote doctor like us who has already completed there? So what's the difference there?
Oh my gosh, putting me on the spot there. I don't know.
I don't know what.
Yes, and actually, that's what I was hoping you're in. There's not much of a difference.
I hope not much.
She's got internal medicine training.
Yeah, she's got like a fair amount of. Yep. So actually, you have not completed step 3 yet, I believe. Yeah. But once you complete step 3, which is the series of tests, there's 3 steps. Once you complete step 3 and get your license, you can practice medicine just like us. You could even go hang a shingle and do everything.
You actually could.
And you are in the process of getting step 3. So you are one test behind essentially where we are and licensure.
Right.
And then we've completed our residencies. That's really the only difference.
Yeah.
But yeah.
Well, actually, let's think about that. When it comes to, I've not done a residency in internal medicine. And she's done.
I haven't either.
She's done almost 1.5 years of it. So she's actually had more formal internal medicine training, if you look at it that way, than I have for what I'm practicing.
Yeah. Mine's kind of, for family practice, we do internal medicine, pediatrics, and procedural. So we did a little bit of everything. So I don't think I could put a number of years on my internal medicine training.
But because she is in her training program, we are her supervisors. So we are over the the visits that she does. So we're supposed to see any level 4 or above patient that you see.
Right.
Which did you see any level 4s today?
You
had an annual wellness visit.
I did.
And then some level 3s.
Yes.
Oh, in a No. Or yeah, that was level 3, the pre-op. So
yeah.
So you would have been able to see all those on your own, although since it's your first day, we're still getting to know you. So of course we're popping in and saying hi. Yeah. So let's see what questions we have since we last checked questions. We have Bernadette Kearney. That's my baby. Oh, she's referring to her cat picture. A little cat picture comes up when she. That's her baby.
That's
either that or she's your mom.
Or your mom is on here.
Did you tell your mom to watch?
Last I checked, mom's name was
not Bernadette.
So
okay. Right. Yeah. You're not her baby girl.
Did you send the link to family or friends to watch this?
Oh,
you did.
She wants to see how this turns out before she puts it out.
They can watch it after the fact.
Exactly.
They won't be able to comment live. So, anything else you'd want to say about yourself to complete strangers watching on YouTube? Or about your experience, or your experience here at the Auburn Medical Group.
Well, today was my first day, and so far my experience has been spectacular. You guys have been great. Thank you guys so much. It's been, from the training side, sometimes it's just making sure you have everything down. Again, we're still in the training phase of a lot of things, and so it's nice to kind of know that this is in line with everything that we're supposed to we're all on the same page, so to speak. Mm-hmm. And so just having the extra validation makes it a big deal. And seeing a different population, I think, really helps too. Most of my, patients are out in the Roseville area, so it's a little bit different, slightly, but it's good to have that difference. So it's been great. Yeah,
different practices will have different populations. Ours will be kind of the older private insurance type, whereas in residency you're probably seeing younger, more of the public insurance type. Yeah. All right. Dr. Nassiri, thank you so much for joining us for the show and for the rotation. We are really glad to have you in our office. Patients seem to be enjoying it. Dr. Gwaine, anything else for our crowd out there?
I don't think so.
Okay. And I will always tell them, if you want to check out Dr. Vaughn's music, Dr. Vaughn is how you find it.
On all that.
I throw that out. That's also what I send out as a link to spam texts and emails. I call it the reverse spam.
Reverse spam.
Thank you for watching.
I'll spam you back.
And people are mostly subscribed who are watching, so I don't tell them to subscribe.
Yeah.
Maybe the bell icon.
Tell your
if
friends.
You don't already have that.
Send this one on.
Yeah. If there's people who are interested in medical topics and like to laugh while they're learning about it,
that's us.
Tell them about it. All right, that's our promotion for the day. Thank you for watching. Thank you, Dr. Nassiri.
Thank you so much.
Until next time.
Hey, I'm Dr. Gwaine Vaughn.
Dr. Mark Vaughn telling you to stay in good health.
Doctors, thank you for another informative session. Auburn Medical Group is located in Auburn, California, USA. Thank you for participating. Please tell a friend and join us again next week.